the latest health trend that everybody is talking about, CBD oil.
Hi, my name is Kristen Nicole Davis. I am a mental health nurse practitioner student at the University of Texas at Rio Grande Valley. Today, I'll be presenting to you the use of cannabidiol, also known as CBD, for the treatment of psychiatric disorders. This will be an evidence-based review. So what exactly is cannabidiol? Cannabidiol is a phytocannabinoid constituent of cannabis sativa that lacks the psychoactive effects of tetrahydrocannabinol, which is also known as THC. Possible neuropsychiatric disorders to be treated with CBD are anxiety, PTSD, also known as post-traumatic stress disorder, alcohol usage disorder, and schizophrenia. Now, we will move on to the evidence-based review. Study number 1 was a systematic review conducted to assess the evidence of CBD's effects on anxiety from 49 preclinical, human, experimental, clinical, and epidemiological studies using a search of Medline, PsycInfo, Web of Science Scopus, and the Cochrane Library databases published up to 2015. The authors concluded that preclinical evidence conclusively demonstrates CBD's efficacy in reducing anxiety behaviors relevant to multiple disorders including PTSD, generalized anxiety disorder, and social anxiety disorder. Clinical relevance: CBD oral doses of 300 to 600 milligrams experimentally induced anxiety in healthy controls without affecting baseline anxiety levels and reduces anxiety in patients with social anxiety disorder. One limitation of the study was current preclinical and human findings mostly involve acute CBD dosing in healthy subjects, so further studies are required to establish whether chronic dosing of CBD has similar effects on relevant clinical populations. Study number 2. The research conducted examined if cannabidiol had any effect on the cognitive impairments associated with schizophrenia, also known as CIAS. Furthermore, comparing the cognitive, symptomatic, and side effects of CBD versus placebo in a clinical trial. This study was a 6-week randomized placebo-controlled parallel group fixed-dose study of oral CBD 600 milligrams per day or placebo augmentation in 36 stable antipsychotic treated patients diagnosed with chronic schizophrenia. The results of the study concluded that at the dose tested, CBD augmentation for 6 weeks did not improve MCCB performance or psychotic symptoms in the sample of patients. The author recommended that more studies are needed, possibly in the earlier course of the illness based on previous research in the prodromal phase of schizophrenia, and that maybe higher doses of CBD may be required.
Steve Daniluk is a retired Marine, now running a hemp company in Colorado.
We're not saying it works for everyone, but we're saying at least give it a shot.
One of his customers, Tanjanika Daniel, a Marine Corps veteran who served 2 duties in Iraq.
When I came home, my PTSD came in the form of nightmares. So I noticed right away something was wrong, and it was up to me to get the help that I needed. The opioids that they prescribed me made me feel like a zombie. I could not think, I could not function as a human. And so I decided to take a natural alternative path.
Daniel turns to CBD and hasn't looked back.
I'm really, really thankful that CBD is an option and that it is federally legal because of the Farm Bill.
Study number 3, the researchers conducted the first study examining the clinical benefits of cannabidiol in patients with PTSD. An 8-week retrospective case series using 11 patients from an outpatient psychiatry clinic diagnosed with PTSD were treated with CBD in adjunct to psychotherapy and their current psychiatric medications. Treatment was assessed using the PTSD checklist for the DSM-5 questionnaires. The authors concluded that administration of oral CBD, in addition to routine psychiatric care, was associated with PTSD symptom reduction in adults with PTSD. The study was significant for future treatments of PTSD, specifically since this was the first study conducted. But further studies, in addition to larger population samples, will be needed for further investigation and clinical comparison. Study number 4. The authors examined the safety and effectiveness of CBD in patients with schizophrenia. In an exploratory double-blind parallel group trial, patients with schizophrenia were randomized in a 1-to-1 ratio to receive CBD 1,000 milligrams per day or placebo, alongside their existing antipsychotic medications for 6 weeks. Participants were assessed before and after treatment using the positive and negative syndrome scale, the brief assessment of cognition in schizophrenia, and the global assessment of functioning scale and the improvement and severity scales of the clinical global impression scale. The results of the study concluded that after 6 weeks, a significantly higher proportion of patients in the CBD group were rated by their clinician as improved on the GCI scale compared with those in the placebo group. The author recommends that CBD may have a beneficial effect on cognition, positive psychotic symptoms, and level of function. Study number 5 was conducted by the researchers and aimed to determine the effects of THC and CBD both alone and in combination on psychotic symptoms and memory function. The population sample of the study consisted of 48 cannabis users from the community on the basis of 1, schizotypal personality questionnaire scores, and 2, the frequency of cannabis use, either light or heavy. A 4-session, randomized, double-blind crossover design was used to compare the acute effects of THC, dosed at 8 milligrams, CBD, dosed at 16 milligrams, and their combination with placebo. The brief Psychiatric Rating Scale, also known as BPRS, Psychotomimetic States Inventory, also known as PSI, immediate and delayed PROS recall, episodic memory, 1 and 2 back working memory were assessed on each day. Results indicated that THC increased overall scores on the PSI, negative symptoms on the BPRS, and robustly impaired episodic and working memory. Moreover, the study provided evidence that CBD was able to reduce subclinical psychotic-like symptoms in low-frequency cannabis users. The very last study is a case study from an article that illustrates the use of CBD oil to decrease the addictive use of marijuana and provide anxiolytic and sleep benefits. The study included a 27-year-old male with a long history of bipolar disorder and a daily addiction to marijuana usage. The patient was given CBD oil over a period of 16 weeks with an initial dose of 24 milligrams with 6 sprays PRN as needed and 2 sprays at bedtime and gradually decreased to 18 milligrams. He was seen monthly to reevaluate his PSQI scores, also known as the Pittsburgh Sleep Quality Index, and his HAM-A scores, also known as Hamilton Anxiety Rating Scale. The results of the case study concluded that while using the CBD oil, the patient was able to maintain non-use of marijuana, maintain a regular sleeping schedule, and reported feeling less anxious. The author recommends that the use of CBD oil can be an effective compound for transitioning an individual off addictive use of marijuana. The implications for clinical practice. So based on the literature review, CBD usage may be a breakthrough treatment to improve the positive symptoms of schizophrenia. Experimental studies found that CBD reduces the overall level of alcohol drinking in animal models of AUD by reducing ethanol intake, motivation for ethanol, relapse, anxiety, and impulsivity. Another implication is the use of CBD oil can be an effective compound for transitioning an individual off addictive use of marijuana. The last implication is understanding whether cannabidiol, CBD, is safe to use in the mental health population is essential for clinical judgment when treating patients. After the review of literature, we can conclude that the use of CBD may have clinical benefit for the treatment of some psychiatric disorders. Even with the recent trends of CBD usage in medicine, more clinical studies will be needed to confirm its benefit in the psychiatric setting.